Hello, patient humans, and welcome back to the show that keeps asking you to trust processes that refuse to be immediately gratifying and somehow keeps being vindicated by biology. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who is about to explain why the treatment that does the least in the first month is often the one doing the most over the next 2 years. Dr. Lazuk is not with us today because she is currently at a regenerative medicine conference in Buenos Aires, Argentina, having agreed to present a single keynote lecture that has since evolved into a 3-day deep dive into collagen architecture, fibroblast response timing, and what she described in her last message as the most underappreciated conversation in all of aesthetic medicine. The conference organizers scheduled her for 45 minutes. She has been speaking, consulting, and reorganizing the breakout session agenda for approximately 60 hours. Attendees describe the experience as unexpectedly life-changing. She describes it as Tuesday. We have sent a return flight. She has acknowledged it. Acknowledgement and boarding are, we have learned, different things. So, you have the avatar, and today we are having the conversation that Dr. Lazuk considers one of the most important in aesthetic medicine right now, because it involves a treatment that is genuinely powerful, genuinely misunderstood, and genuinely wasted on anyone who has not been properly prepared for what it actually does. We are talking about Sculptra again, but this time we are going deeper into the biology, the timing, the psychology, and the very specific kind of person this treatment was designed for. Let us start with the expectation problem, because it shapes everything. When people hear the word injectable, they expect immediacy. A line softens, a hollow fills, a reflection changes before the appointment is over. That expectation has been built and reinforced by years of filler marketing, and it is completely reasonable if you have only ever experienced hyaluronic acid fillers. Those work by physically occupying space. You inject the material, the volume is there, immediately. Sculptra does not do that. It does not announce itself in the mirror. It does not create instant contour. It does not reward impatience. And if someone walks in expecting the filler experience and receives the Sculptra experience instead, they will almost certainly feel that something went wrong. Nothing went wrong. The wrong treatment was chosen for the wrong expectation, and those are very different problems. Here is what Sculptra actually does, and why it matters more than most people realize. Most faces do not age primarily because they lose volume. They age because the framework that holds everything in place weakens. Collagen thins, elastic support loosens, fat pads shift. The scaffolding that once kept everything where it belonged gradually fails. And when that scaffolding fails, skin stops behaving the way it used to, even when volume is technically still present. This is why adding filler sometimes helps at first, and then slowly starts to feel heavier, puffier, or less natural over time. Because the problem was never simply absence of volume, the problem was loss of support. And filling without restoring support is like furnishing a house whose walls are slowly giving way. The furniture is fine, the structure is the issue. Sculptra exists precisely for that structural problem. Poly-L-lactic acid, the active component, does not fill space. Once injected and once the initial swelling resolves, the material becomes essentially invisible. What follows is not the persistence of an injected substance. It is a biological response. The PLLA particles signal fibroblasts, the cells responsible for collagen production, to begin rebuilding the dermal matrix, gradually, layer by layer, over months. The visible improvement that develops is not the product. It is new collagen, your collagen, built by your own biology in response to a signal. That is not a filler. That is a structural restoration. And those two things require entirely different timelines, different expectations, and a fundamentally different relationship with your mirror during the process. Here is what the timeline actually looks like. because nobody explains this clearly enough, and it is where most of the frustration originates. Collagen does not regenerate overnight. In the early weeks after treatment, you may notice essentially nothing, or you may notice slight swelling that resolves and leaves you wondering where the result went. This is normal. The result has not arrived yet. The fibroblasts are responding. The matrix is beginning to reorganize. The process is underway. But it is working on biology's schedule, not yours. Over the following months, something quieter begins to happen. Skin becomes firmer before it looks fuller. Contours improve before volume becomes obvious. Laxity softens without the face ever looking treated. And often, the most noticeable improvements arrive well after the last treatment session. Collagen continues building after the syringe is empty. It responds to the signal for months. People describe the results indirectly. Makeup sits differently. Photos look better without trying. Skin feels firmer when touched. Friends ask if they have been resting well or if something has changed, without being able to identify what. That is not accidental. That is structural change presenting itself the way structural change always does, gradually, naturally, without announcement. Now, who is this treatment actually for? And equally importantly, who is it not for? Sculptra is most effective for faces that are changing rather than collapsing, early to moderate laxity, gradual softening through the mid-face, cheeks that no longer reflect light quite the way they once did, skin that creases more easily and recovers more slowly than it used to. A general tiredness in the reflection that appears even when you are well rested. In these faces, collagen stimulation can restore resilience before heavier intervention becomes necessary. It alters the trajectory of aging rather than correcting the damage that has already accumulated. Sculptra is not ideal for someone who wants immediate visible correction of a specific concern. Deep nasolabial folds that need softening now. Hollow tear troughs requiring careful placement. Lips needing volume today. For those concerns, hyaluronic acid fillers are the appropriate tool, not because Sculptra is inferior, but because it is designed for a different goal entirely. The question is never which treatment is better. It is which treatment matches what the face actually needs right now. There are also important cautions worth naming directly. Overuse is one of the most common and most consequential mistakes. Because Sculptra does not show immediate results, there is a very human temptation to add more before the first round has fully declared itself. Months later, the face looks fuller than intended. Volume has accumulated where it was not needed. Collagen does not respond to urgency. It responds to spacing. And once it has built, it does not simply dissolve the way a filler does. Patience is not optional here. It is biological necessity. The other important reality is that collagen quality depends entirely on the environment it is building in. Chronic inflammation, poor circulation, significant stress, inadequate nutrition, all of these affect how collagen forms and organizes. Stimulating collagen production in a hostile internal environment produces weaker, less elastic tissue. This is why outcomes vary between individuals even when technique is identical. Two people can receive the same treatment and look dramatically different 6 months later. That variability is not a flaw in the technology. It is biology being honest about conditions. Here is the psychological dimension that almost never gets discussed, and that Dr. Lazuk considers genuinely important. Because Sculptra produces gradual results, patients do not experience the jarring before and after moment. They adjust alongside their reflection. The improvement feels continuous rather than sudden. The face feels familiar throughout the entire process. And perhaps most meaningfully, people do not look different. They look like themselves, with better support, with more resilience, with a face that is aging on a slower, more graceful trajectory. Aging well is not about erasing change. It is about slowing the destabilization. Sculptra fits that philosophy more naturally than almost any other injectable, which is exactly why it appeals to people who want to invest in longevity rather than transformation, and exactly why it disappoints people who measure success by instant visual payoff. If you find yourself asking which is better, Sculptra or fillers, the honest answer is that it depends entirely on what the face needs and what the person values. A well-supported face often needs less filler overall over time. That is one of Sculptra's quietest advantages. By strengthening the framework early, it can reduce the need for repeated volume correction later. But that benefit only emerges when treatment is planned thoughtfully over time, not stacked impulsively in pursuit of results that the biology simply cannot produce on demand. The real question is not whether Sculptra works. It does. The real question is whether you are trying to correct a feature or support a process. That distinction quietly determines everything about whether the experience will feel satisfying or disappointing. Faces do not age because they lack filler. They age because their scaffolding weakens. When that scaffolding is supported early and intelligently, everything else works better. Treatments layer more naturally. Corrections require less force. The face retains its identity longer. That is what Sculptra does best. Not because it fills, but because it fortifies. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, a treatment recommendation, or a clinical assessment of your individual anatomy or aging pattern. Sculptra and all biostimulatory treatments require professional evaluation by a licensed physician who can assess your specific goals, tissue condition, and long-term facial trajectory before any recommendation is made. Please consult a qualified dermatologist or aesthetic physician for personalized guidance. Dr. Lazuk will be available for consultations as soon as Buenos Aires releases her and someone locates a flight she will actually board. May your skin always glow as brightly as your smile.